Health insurance is absolutely important. The way into the future, there is no other way but to finance health through public financing, donor support, and every other support that we can get from different organizations, and pulling all those funds together into a risk pool, and then defining what your benefit package will be. And the benefit package is designed based on the health burdens that are prevalent in any population segment that you want to cover. So for Kwara, we're only looking at disease burdens that affect us in Kwara. And we are not even considering what is happening in Udi, who is our neighbor or Udoski. Health insurance can only work if we have some structures in place. Number one, we have the legal cover, which is the laws. And now the National Health Insurance Authority, National Health Insurance Act has also been enacted last year that makes health insurance compulsory and mandatory for all Nigerians. Why? Because if we leave some segments out, they become a risk to others. And until we have a full financing pool, we cannot sustain a scheme that big. On the demand side, we purchase services, and that's the job that the Kwara State Health Insurance does. We purchase services from accredited providers. We define what our benefit package will be. And we started a lot of advocacy, awareness creation, and we started linking up with high net worth individuals in the state. We started going after community development associations, and particularly our invaluable sponsors, KSAN, the Lorry Emirate Youth Development Association, Uduna, and different others. That health insurance in 2020, because we had not met the requirements that the National Health Insurance Authority gave us then to commence the Basic Healthcare Provision Fund. And I knew one of the things that was delaying us was the counterpart fund that we couldn't pay at the time. But then the governor came, and soon we had paid the counterpart fund from the federal government through the National Health Insurance Authority. And every subsequent year, he has provided this counterpart fund. And so because of our trajectory on onboarding has gone at a very fast pace, where we will be waiting for funds to see, okay, how will we enroll these other people? Then we see funding coming, and then we're busy enrolling all across the state. And we make sure that our enrollment is equitable across all 16 local government areas. We never leave anybody behind. Now they're coming up and onboarding our beneficiaries as families, because that's the only way that we can attain universal health coverage. If you're picking individuals, supposing I cover the dad and
recording in progress.
Supposing I cover the dad and the mom gets sick, how do I take care of the mom? So that is why we are now looking at a layering effect, introducing different layers of social interventions. Things that we've started to do is to look at how we increase availability of quality services across the state. And as you know, I said in the beginning that we're not going to leave anyone behind. So we've gone further to take a look at our indigent populations and how we can support them to bring quality and affordable healthcare services right to their doorstep. In the spirit of that, I remember that a few years ago, when the governor was going to do our budget exercise, we went to the school for the special needs, and we did our budget revision at that school. And that was the first time it afforded me the opportunity to walk into that school. I've driven past there, but I've never really paid attention. But the governor making sure that budget exercise happened within the four walls of that school helped me to open my eyes that, oh, there's a population here, and how do we begin to help them? Secretly on my own, after the budget exercise, I went back to that school because I wanted to see how they could be helped and what health insurance could do for them. Most of these kids in that school are physically challenged, either blind, deaf, deaf and dumb or impaired in one way or the other. So it doesn't afford them the opportunity to leave their schools to go and access healthcare services. They had a small clinic, more like a dispensary really. And we looked at it and thought if we were to provide health insurance access to all these children. So when the kids, we've just finished the project, and I'm going to show you the before and the after pictures, so you could sort of see, and maybe a video of the new clinic at the School for Special Needs in Apata Yakuba, courtesy of the support from the Kwara State Health Insurance Scheme. So and we hope that we can continue to do things like this across the state to continue to improve access to healthcare services. This is the interiors. No plumbing works, no water, no equipment, no furniture, things like that. Can you keep going, please? So this is part of the renovation work. We have equipped the school. We have fully renovated the school. We have fully renovated the clinic. We have equipped it. We have gotten additional staffing. So this is a pet project of the Kwara State Health Insurance Agency that is just completed. So that when we did water reticulation, they now have running water. They have taps. They didn't have all of that. They have equipment, newly renovated clinic, beddings, curtains. So the school is ready to go. The school clinic is ready to go. When the children eventually come back to school, they are on summer holidays now, and now we have just concrete on the floor. We have full tiling now. Everywhere is tiled up, doors change, windows change, complement of new furniture, beds, as you would see, and this is all gone out of funds that would have accrued to this school clinic from the health insurance. We just took a percentage of the funds and gave it to them up front, and this is the product of what we got. New cabinets for storing medications, equipment, things like that. So this is one of the innovative ways that we are using to improve quality and access to care across the state, and we are hoping that we can do many more of that. We are also collaborating with different financial organizations and looking to put what we call market hubs in big markets across the state, where you have like a minute clinic, so that traders who are trading within the market don't have to travel far to access healthcare services. And we are hoping that some of our providers will come on board with us and take over some of those hubs, market hubs, as an extension of their own facility, so that we can at least provide primary services to people who are busy in the market, and then if they need referrals, they can refer them to their main hospital. So those are some of the pet projects that we are working on currently to bring access to healthcare services closer to the doorstep and to businesses of people across Kwara. Thank you very much.
Good morning, everyone. Mrs. Latif, CHF of FAC. Yeah, I think the program has been well, but we find out that some needs are not yet
recording in progress.
The scheme, so they don't come as often as we want them to come. I think in the facility we have about 600, but out of those 600, at least if you can get 100 in the month, that's what we do, but we still want more people to come.
It's not in all instances. If somebody did not get their card, how would they know to go to the facility? Yet the facility is documenting, and they have best utilization data in the agency, only that they were fictitious. So this also happens, and I want you to know. Our providers are incentivized in two different ways. We pay what we call capitation, and capitation is paid ahead of treatment. Whether the patient comes or they don't come, they must get that capitation every month. And so we cannot say because somebody did not come in month one, But now came in month 2 and you are telling them this drug is not available or this drug is too expensive. What happened to the previous months when it doesn't only happen in private facilities, it also happens in public facilities when enrollees who have health insurance cards are made to wait while those who are private pay are paid. And I had to call one of the general hospitals somewhere in the north to say that you forget that capitation that comes into your account every month, whether you like it or not. It comes automatically every month. What do you think we are paying for? So when the enrollees come, yes, they have really paid because we are paying capitation every month. So I don't know why they will tell them to sit down when this is the guaranteed payment that they will get. This is the guaranteed payment that you get every month because every other private pay enrollee there's a risk and you are not sure whether they will come. You cannot open your door as a private provider or a public provider and beat your chest that 20 people will walk in today because you don't know. It's when they are sick they will come and only those that can afford to pay. But for insurance enrollees, come rain, come shine, you get their capitation. So when they come, I think they should be given first class treatment, not wait until your private pay patients who you don't know whether you will see them again for the rest of the year will come in. So it's good for the providers also to hear. But I must also state, to be fair to our providers, that there can be very cantankerous beneficiaries who come in. I've had interfaces with providers where somebody got up and said, look, they've told me that this card cures everything. There's nothing wrong with me, I just came to collect drugs. So they will say that, and then or they walk into their facilities and do like this, check me all around. Check me. There's nothing wrong with me, but just keep checking me because they paid you. So sometimes it's a waste of time for the providers. But we always encourage them to say, if they come and you check them like there is nothing, how much does paracetamol cost? Or multivitamins? Give them people, let them go home and go and be buying them in the market. You'll be making them hungry to eat more and more. You know, something, just satisfy them. That's all I'm saying. Give them multivitamins, it can't hurt them. Let them take these multivitamins and leave your neck alone. Because that would happen. You know, I've had instances where enrollees will say, hey, I went there last week. They gave me A, B, C, and D. Take my card and go. And the providers, when they get there, they won't even look at the face of the person presenting the card. Is that person's sister, is not the owner of the card. But the sister has told her that if you go there, there are goodies there for you to collect. So the sister will bring the card. We are only paying capitation for one person, but now it has become 3 people because they are sharing cards. They will take the cards, but it's a loss to the providers. So your front desk has to be strong. You know, when you check the cards and make sure that the face on the card is also the face of the person that is looking at you. Otherwise, you will be draining financially and you will not know. We tell the providers this, but we also are stern with our providers when it comes to enrollee benefits and what have you. But not all the providers will be 100% excellent. We are all work in progress. But each one that we identify, you can be sure that we would address the issues. And the third way is going on the radio, on media, social media. We are all over. You know, we do jingles, we do radio interviews, and we specifically speak on topics that affect our enrollees from the feedback that we get from the enrollees. So I hope I've addressed all this. Every other thing, providers have a way for redress. Enrollees also have a way. Please share our 0800 number with all your enrollees. It's also behind their card. They just don't know. If they flip the card, they will see that toll-free number. And it's made toll-free so that they don't have to worry about credit when they need to contact us. Thank you very much.
Dr. Jerry, you are doing a very wonderful job. Honestly speaking, I don't know that something like this is going on. And this is what we need at this very crucial time. There are certain things that are very, very important. Anything relating to health, food, and education. These are the 3 things we need now. But more importantly, health. By our calculation, we learned that any age about 40, you will start nursing something that will kill you at the end of it. Yes, this is the truth. How many of us now that are in this order, when I say, are you all right? Your mind will tell you that I'm all right, but your mind will tell you that I'm all right, but that but everybody has it. You see, when she was talking the other time, I was just laughing. There are some people, if you say this is a paracetamol, they don't need it to, but they will go there, they will fill the first pocket and the second pocket because of what? Greediness. I remember when I was at the Ministry of Agri, to be precise, Kwara EDP, we were to distribute fertilizer and inputs, maize, rice. They want to be planted, not raw one. No. It has been treated with chemical. Do you know what our people did? They collected it. They say running. They're about to for they were lost. Except for Jamaica, come on, Jet. But I just say, Gito and let me see like when I had it, honestly speaking, I felt something that is meant for planting. And you are now eating it. So honestly speaking, you are doing a very meritorious job. What I will want you to intensify more is monitoring. By the time you monitor, you will be able to evaluate, and this one will be able to give you the next step to follow. God in this evening must continue to be with us. Amen.
The Secretary, Kwara State Insurance Agency. You know, as I sat down here, I was just telling myself that what's the best thing to do again, because I'm actually the picture. I know the lots of efforts that are put in to engage the providers, to engage the release almost every quarter. We just finished the second quarter policy assurance. First of us went around the facilities to check around what are they doing well, what are they not doing. You know, because and a lot of money are put into these programs and activities and efforts. Sometimes I've been with the ES for like 4 hours. We'll be talking, engaging the release. We've been on the radio together also. So I know a lot of efforts are being putting in. But we still just want to encourage you now. We know that we're not relenting on efforts. I bring greetings from the Permanent Secretary, Minister of Health. He has Dr. Abubakar. He has another engagement. That's why he's not here. And on the side of the ministry, we'll be ensuring that for the help of our amiable governor, the Catawba Fund, for Basic Education Fund, for those enrollees under the scheme, that particular scheme are always being paid, like you mentioned earlier, are being paid every year, and the governor has really been supportive. We want to thank His Excellency. I also want to mention that for our providers, we want to still encourage you. We know you are doing a lot too, and the system appreciate what you are doing. You know, we just started this scheme about 3 years ago, and we still want to encourage you to do more. Most of our complaints have always been from the release, saying that maybe, okay, you are not doing enough, you are not supporting them, and treatments maybe are not the way they actually want it. We want to encourage you to still do more, and we know that as you are doing more also, you also get more. Then at the aside of advocacy, I want to still beg our providers, please help us with advocacy. We want to also beg implore our sponsors also. We want to appreciate you. We thank you for what you are doing, the ODU and the Chago and the other supporting groups. We want to appreciate what you are doing. But we want to have a kindly request that also help us with advocacy. Personally, I've taken it upon myself almost everywhere I go and I talk to people about health insurance. I was with the Nigerian Union of Journalists, the retirees recently, and I told them about health insurance, and some of them started went to inquire on how they can enroll, because it's actually important when we let people know the benefits of health insurance, that you can pay 6,000 as a premium for somebody that is a trader, and you enjoy the benefit of 100,000 in a year. People will want to. They want to. Some people don't know the importance of it. But by the time we break it down, so I want to encourage one of us, let us all be advocates of Kwara State Health Insurance Agency. And we know that since last year, it has been signed into law that the health insurance is now an authority where every Nigerian is supposed to be under health insurance covered, even as mandatory and compulsory. And we cannot do this. This is very important for us to enjoy, to actually achieve what we call universal health coverage. And that's what all our support groups, that's what we've been doing. Because the support groups have been helping us to achieve universal health coverage. We are paying for people that don't have the money, they don't have the capacity to enjoy free health care. So I want to implore you to still continue, and we appreciate what you are doing, and we pray that God wants to bless you, God wants to support you also. Thank you so much, we appreciate it.
I want to commend Executive Secretary of Kwara State Health Insurance Agency for a job well done. From what I can see, I will refer to her as a magician because I don't know how she does it. The Kwara State government, I want to commend the state government too for always releasing their counterpart funds on time. And I want to commend the sponsors for deeming it fit to contribute to the health of their communities and their workers. There are so many problems with the health insurance industry. We have been a practitioner for the past 20 years now, and we know where the shoe pinches. Why I said I'm calling her a magician is that I don't know how she does it with 6,000 naira calculation premium a year. I hope there are not many providers here. Because with us, as the National Health Insurance Authority, we actually do the same thing. We are in the business of health insurance together. But where it is different is we started earlier, and we midwife with various state health insurance agencies in order to get closer to the grassroots. We charge 45,000 naira premium per annum. With 45,000 naira, you can register as an individual and you can bring 2 dependents, making it 15,000 naira per annum. And even with this, the providers are complaining. So I don't know how she does at home with 6,000 naira. So I would like to look at to implore our sponsors to take a look either at the benefit package. We want to help our people, but how well do we want to help our people? What is worth doing is worth doing well. I'm sure 6,000 naira will go to a provider that wants to treat malaria. They will charge you about that for just the treatment. And I want to sponsor somebody for. Anyway, it's what the health insurance agency is requesting. But I think it's better we sit down together to really look at this thing. What is 6,000 naira going to take care of in Nigeria today? So I would want you as sponsors to even go to her question marks. Yes, But we have to tell each other the truth. Question her, tell her what can this provide for my people. So that if there is a way you can help it, you help it. Tell her to get actuarial studies so that you can determine what actually can take care of my people very well. The NLC, allow the representative is here. NLC, your health insurance has come to stay. Is paying out of pocket, it's out of fashion. They don't do it all over the world again. I think it behoves on you to educate your people that we need to log on into this. It's very, very important. Okay? So, what again? Somebody complained about laptop, that they don't have laptop in the facility. I don't know why this is happening. Because at NHIA, what we emphasize is that capitation should be paid to the providers, because they are the ones that know the needs of the facility. So I wonder why you cannot be able to afford to buy a laptop. I think the ministry will have to work on that. If there are layers of bureaucracy or authorities, or let these people be free to purchase what they actually need. Because if they can't get it, they can't provide good services. So once again, I thank everybody for coming. We are in the business together, and I told you we support each other and we do virtually the same thing. So thank you very much.
I bring one greeting from Her Excellency, Ambassador Professor Dr. Sir Ambassador Professor Mrs. Olufolake Abdulrasaq, the First Lady of Kwara State, and Chairperson Nigeria Governance Vice Forum, to this gathering, particularly the Executive Secretary and members of our team in the Kwara State Health Insurance Agency. Her Excellency want to identify and for me to identify which laudable job of the agency, particularly in amplifying the everyone matter policy of Governor Abraham Abdulrasaq's administration in health sector. We have listened to and we have witnessed how the agency has been able to carry every sector of the society in the health program of His Excellency. That means the rich people are able to key into the program of the health sector of the state government. The low-income people have been able to benefit tremendously from the health sector of the state government. Even people with special needs are equally benefiting from the health program of the Kwara State government. Which agency is making this possible? Policy of Kwara State Health Insurance Agency. Those of you, I'm not grateful for your help. Her Excellency, want to appreciate the service providers for doing a good collaborative job. The sponsors is being appreciated by Her Excellency. And of course, Her Excellency want to appeal to all the relevant stakeholders to close the gap that is militating against efficient service provider through Kwara State Health Insurance Agency. We have listened to how the service providers have not been able to be on the same page with the Kwara State Health Insurance Agency this is in an area that you can close through collaborative effort. Excellency want to appeal to everybody that any program require time to mature so that you'll be able to enjoy, to drive maximum benefit from the program. Some of the teaching problems that are highlighted about this program, we want to say, is due to the fact that the program is relatively new in Kwara State. So, with your cooperation and your support, we believe that the sky is the limit and we'll be able to enjoy maximum benefits from the program. Once again, Excellency, we want to thank everybody for participating in this valuable program. Thank you and God bless. Is a man wearing a woman, I mean,
The representative of the head of service here present, the executive secretary of the National Health Insurance Agency, all the invited, our esteemed sponsors here present, all our providers here present. On behalf of the executive secretary of Kwara State Health Insurance Agency, I wish to appreciate every one of us here present, especially our sponsors. We really appreciate you for your kindness and by deeming it fit to sponsor some of the beneficiaries who register on the Kwara State Health Insurance Agency. Just like the executive secretary mentioned the other time, he said that there is difference between the beneficiary and the enrollees. We have a lot of beneficiaries on our database, but few of them have been sponsored or have been enrolled because of their incapacity. They don't have the money or they don't have the ability to register, to enroll under the scheme. So we now have a group of people who come together to sponsor some of these beneficiaries. Then we should give kudos to those groups. So on this note, we want to appreciate you for sponsoring some of these beneficiaries. And I want to encourage you and urge you again to let us continue in this collaborative journey towards achieving this universal health coverage to our people. So because there are a lot of people that are benefiting from this scheme, and a lot of benefits has been derived from the scheme due to the way you have sponsored these people. So I want to encourage you to let us continue in this partnership so that all our people will have access to care. I thank you very much, and I wish every one of us a safe journey back to our various destinations. Thank you.